All right, with that, I'm going to go ahead and give a quick introduction to our presenter this month. Janee Harvey is the Division Administrator of Adult, Children, and Family Services with the Iowa Department of Human Services. And she's here to talk about the implementation of Iowa's Family First Prevention Services Act and provide some more information and context about the operations surrounding the implementation of that plan. So I will go ahead and let you take it from here, Janee. Thank you.
Hi, thank you for the invitation to join your group. It's always a little strange for me to present and not see people's faces, but I know you're out there. And in terms of my presentation style, I love to be interrupted. For me, that shows kind of engagement with the material. I cannot read chat boxes well while I'm talking at all. So there will be some natural pauses and some key places where I'll ask people to jump in. So I hope you feel brave today and unmute yourself and ask whatever questions that you have. So in terms of my position at the Department of Human Services, within my division specifically are 4 different bureaus. I oversee the Bureau of Child Welfare and Dependent Adults. I also oversee the Bureau of Child Care, Food, Financial Work Supports, and then Quality Control. So I am specifically here presenting on our Family First implementation. But if you have a key interest in any one of those areas, I may be able to answer kind of off-topic questions or am happy to hear from you after the fact. So feel free to follow up with me. So I am going to steal your screen. So just, oh, nope. I do not have permission.
I will go ahead and enable that for you.
I'm not going to do anything Zoom bombing or something, Bree, I promise.
Sounds good. I'll hold you to that. I will. All right, you should be good to go.
All right. Okay, fantastic. Okay, so let me change my view. So I'll go away box. Okay, my top banner is not going away. Go away. So I can, okay. Well, hopefully my Zoom banner, it usually kind of floats up and then I can change the view. That is not happening at the moment though. So for now, we will deal with this view. So the Family First Act, for context, is a federal act that was signed into law of February 2018. Immediately upon that act being signed, Iowa pulled together a design and implementation team because we knew immediately there were big changes coming to our state. As I would describe it, some of those changes immediately translated into growing pains. So places where we definitely have had some pain points. But growing pains mean that you're experiencing growth, that there's actually something good coming out of that inherent challenge that came with that Family First Act law. The other were some very clear opportunities that prior to the enactment of the Family First Act, Iowa didn't have these financial opportunities that were new and were created when that act was signed again in February 2018. States were allowed within some pretty broad timeframes when they would officially go live with the changes under the Family First Act. For Iowa, we decided to officially go live October 1 of 2020. So we are less than a year into our formal implementation of these very significant changes that came with the Family First Act. So kind of my elevator speech, if I were to come across someone or literally get on an elevator and they say, what's this Family First Act about? I'm hearing a lot about it. What are you guys trying to do here? I would simply tell them that children do best in families. And as much as that is not rocket science, that probably doesn't surprise anybody on this presentation today. I'm sure I'm sure you think this is true for your own kids or kids you may know in your life. You would say, yep, they do best when they're with their family.
Janee, I'll be the first to interrupt since you said you don't mind.
Yeah.
Oh, and I just see it popped right up there. That was going to be my question is, can we have these slides at some point?
Absolutely. So I think I've already sent them to Bree, but if not, I am happy to send them and you can have all of these. In fact, there are some hyperlinks in this PowerPoint that I will be navigating through. Those hyperlinks will also work on the PowerPoint that you receive. Great
And
question.
I do have those, Janee. Yep.
All right. Okay, my first task, check. So we know that children do best in families, but that is not actually how child welfare has historically operated. I can literally point to Iowa's own specific history in the early 2000s. There was a child fatality that had a lot of media exposure. And at that time, our governor became pretty kind of child welfare famous, at least, for saying, if in doubt, you take them out. So if we have any doubt about a child being safe in a home, take them from their families. And while child welfare historically has done a very good job of maybe responding to the imminent physical needs of children, we have not been as sophisticated and cognizant of children's emotional, psychological, and social well-being. So said another way, removals and placement in foster care are known traumas to kids. So I don't think, nor would I support Iowa being a zero removal state. I do not think that's realistic. We have lots of parents that we become involved with who cannot do some pretty basic acts of parenting that would need to be done in order to keep kids safe and well. But when I moved to this state in 2015, it was data that quickly caught my attention that Iowa's rate of removal was more than 50% higher than the national average. So unless somebody were to be making the argument to me that Iowa's parents are fundamentally just worse than other states and significantly worse, like not even close, right? So the national average was closer to 6 kids per 1,000. So if you looked at 1,000 kids in the general population, the national average was approximately 6 of those kids would have experienced a foster care placement. In Iowa, we were over 9. So that's a lot. So under the Family First Act, tying this back to this federal act signed in 2018, it is fundamentally a financing bill. And if I wanted to lose all of you, I could strictly just talk about the money because it's a very technical bill in many ways. But in terms of describing the overarching effect this bill has, it's basically that for the first time, states are allowed to receive significant federal financial support for implementing evidence-based programs that help keep kids out of foster care. So those are evidence-based family preservation services. So if we know that children do best in their families, and if we know that there are evidence-based, research-validated programs that have demonstrated positive outcomes that both keep kids safe, but also keep them with their parents, we should be implementing those. Iowa had not implemented any of those. Under the Family First Act, they re-emphasized the importance of if we cannot keep kids with their parents, so in that home of origin, we must identify and support relatives of those children and fictive kin. So some people jump in here and sometimes question me or ask, like, what is a fictive kin? How I functionally describe that is any caring, stable adult that has a meaningful relationship with a child, even if there's no blood relation. My guess is that there are probably everybody on this call today has fictive kin in their life. Those are the people that you call on a bad day, even if those people that you call are not blood related to you. If we have exhausted our efforts to keep a child with their parents, their relatives, or fictive kin, then we are allowed to look to licensed foster parents for placement. And the way that I describe this is, and I'm a former foster parent, so I absolutely believe in the value and importance of having these licensed parents, these licensed foster parents whose homes are safe and they've been trained to help support the needs of kids. So these are really critical to our whole system working well. But a child who is going through the worst day of their life, which is a removal from their parents. So even if it's a necessary action, there is no child that thanks us for a removal. It is scary, it is traumatic. They are not just being moved from their parents. They are being moved from the home that they know. They are definitely losing physical belongings that have meaning to them. They might be losing neighborhood friendships. They typically are moved from their school. So all of the connections and all the things that give them meaning, they are losing those things when they are being moved from that home. So these are bad days for kids, right? When we are then able to transition those kids into relatives that they know, that might be grandma's home where that kid has spent the night many times. Sometimes we have licensed child care providers who are already providing care to that child during the day. That's a pretty seamless transition for them. So even though it may be scary, we have kind of softened the edges of that trauma when we're able to keep those kids in their natural support system. So that's really important. When we move to placing with a licensed foster parent, even though from a DHS perspective, we can assume that that home is safe, that licensed foster parent has been trained and is equipped to meet that child's need, that does very little for the scariness that that child is encountering, right? It is very hard to explain to a child, you're going to be okay in this home because they're licensed. They have a lot of training. That's not really the response that children are looking for. So I think when we describe it this way, it becomes not just logical, but imperative that we get this right for kids when their own primary caregivers, typically their parents, have failed to keep them safe. Another version of safety is then navigating from their perspective, who else matters to them, who else cares about them, and then trying to place kids in those environments. And then you see congregate care as the third and final bullet up there. Child welfare has a pretty heavy history of putting kids in what we call group care or residential placements, especially older kids, not because they need to be there, but because sometimes it's hard to find homes for those kids. The Family First Act, again, it's a funding bill. So it's not that our federal partners are saying, hey, Iowa, you can't place kids in residential if you can't find a home for them. They're just saying that we can't receive any federal financial support for those situations. We are limited to receiving that federal financial support for kids in residential care if they need to be there for treatment. So those youth must have known short-term or long-term behavioral or mental health needs in order to qualify for that placement. If they do not have those behavioral or mental health needs and they're placed in that congregate care setting, that needs to be funded with 100% state dollars. So just for context, I can let you know that 1 year of care for a youth in a residential placement is around $50,000 a year. So that's a lot of money. That's a lot of money whether we're receiving federal financial support or not. So at that cost, I think it is fair to get us to consider what else could we do for $50,000. You could almost buy a full-time social worker for a kid, 100%. That could be 100% of their time. And it would almost be a cost equivalent. So That reduction or that limitation in the federal money for kids in residential setting is what I would describe as one of those growing pains. It's been hard. We are making the pivot, and I'll have some data to demonstrate that. But that's a real challenge to do a system shift to align with these federal expectations. Okay, this is a good time to pause because I'm going to go a little deeper into some other parts of the Family First Act. But what immediate kind of questions or concerns does any of this raise for you?
I would just ask, I mean, I know how important it is for children to be with their family, and you've talked about some good points. Is there anything offered to the children from the state if they are taken from their home? Mental support, future like success plans, growth, that kind of thing, so that the children don't experience the crisis of that, repeat those patterns?
Yeah, I mean, you raise a really good point. So in child welfare, we try to do family-centered and child-centered planning. So what we would have laid out, there's a lot of federal requirements, like pages and pages of requirements when a child is taken into care. So when DHS has that guardianship over those kids, we have to do case plans at regular intervals. Those case plans are supposed to include domain-specific planning around their health, their mental health, their education planning. So sometimes that's behavioral health planning as well. Obviously, with child welfare being managed at DHS, we have a very close partnership with our own MHDS division. Actually, I just came from a meeting this morning, getting updated on a number of those crisis services that are being rolled out regionally and around the state, whether that's mobile crisis or temporary crisis beds. But we're also looking at trying to avoid those crises. So we're looking at, we're working in collaboration with some of the MCOs about respite care. So what does it mean for a child to be placed with grandma? And some of those behaviors we see with a kid who has a history of abuse and neglect, those behaviors can be very complicated. Those behaviors can scream pain, right? That can overwhelm some of these very relative or fictive kin we're trying to place with. So we're trying to proactively look at billing for respite care. So maybe an aunt or a grandma, or maybe it's just a family friend who's taking the kids in, how they can get some planned days off to help lower the stress and provide support for that family unit. So there's a lot of examples of that. Are there other questions before I move on? Okay, so as much as there's some growing pains under the Family First Act, I also mentioned that there's some enormous opportunity. So for the first time, Iowa, just like all other states, we are able to pull down 50% of the cost of providing evidence-based foster care prevention services. So I think it would be important for this group to know that the types of services we are able to bill for is pretty limited. You can see that top bullet point. In-home parenting skills training that includes parent education and or family and individual counseling. So that's an example of a service that if DHS is providing, we can, our federal partners will help cover 50% of the cost of it. If that service also meets the next two criteria. The second criteria is that that service is being provided to a family whose child is at imminent risk of entering foster care. So in order to meet that definition of having imminent risk, this is a family that must formally be involved with DHS. It would be very hard to argue that a family out in the community with no DHS involvement is at imminent risk of entering foster care. So it must be a DHS involved family. And then the third criteria that must be met in order to pull down this new funding stream is that the services must be an evidence-based practice. So those practices are tiered as promising, supported, or well supported. For instance, a supported evidence-based practice means that it has gone through either a random controlled trial or a quasi-experimental design, and the outcome of that research was that families who received that intervention had positive outcomes 6 months out after the conclusion of treatment. A well-supported, what'd you say?
I'm sorry, could I interrupt again at some point whenever you're done with this thought?
Let me define well-supported, and then, yeah, I'm happy for your feedback. Well-supported is defined as having gone through at least two research-validated research evaluations that must be either random control trial or quasi-experimental design. And those families must have positive, sustainable outcomes at least 12 months after the intervention is ended. So you can see that they have some pretty rigorous criteria around determining what is considered a promising, supported, or well-supported program. And the Children's Bureau, which is our federal office counterpart, they have something that they've established called the Federal Clearinghouse. So the only models that we are able to pull down funding on must be in that Federal Clearinghouse and must have one of those evaluation criteria met. So they would be determined to be a promising, supported, or well-supported in that clearinghouse. Okay, go ahead with your comments.
You probably will get to this, but I'll be listening for, this is all foster care prevention services, which is great. What about the parent who, something catches them off guard, they have their child or children is into foster care and they're trying to reunify the family? Is there this kind of support or service also available to them?
Yeah, so you are like it's like I planted you in the audience, because you're asking a really good question that's going to segue nicely in the rest of the presentation. What we have, those programs cross over both as foster care prevention, but they can also follow the family if the child is placed in foster care. Many of those interventions we're using work in both scenarios, but once a child is removed, we no longer meet that middle criteria. They are not a candidate for foster care any longer. They're actually in foster care. So at that point, we cannot pull down these additional federal funds. We can still provide that programming, and we do in Iowa, but that new and different federal funding stream goes away because the child's in foster care. You guys ask really good questions. Who else? What else do you got?
Do you have a sense of how often you can see this coming? Like, how often could someone qualify for this?
So as long as they meet that definition of being a candidate for foster care, there are no kind of caps on a reoccurring family. We know that family stability is not linear. So some families kind of cycle in and out of instability and cycle in and out of DHS's attention. So as long as we're giving an evidence-based intervention to those families that qualify, that's when we can pull down the federal funds. But again, as Iowa, how we kind of schematically have our services array set up, whether you are in foster care or not in foster care, you are still going to get a similar service, just the funding streams become different, whether there is a foster care placement or not. So you can see the top bullet under quality of service. The Family First Act actually says that because most evidence-based programs are approximately 6 to 9 months in duration, they say that after 12 months, we cannot continue to receive that federal financial support. They've actually backtracked on that. As long as we can justify in the case plan why we are extending the evidence-based service beyond the 12 months, we can actually continue to receive that federal financial support. So that's kind of the one caveat to that. Okay. I'm just going to touch on this slide quickly because I'm only on slide 4. So I need to talk quicker is what needs to happen. So the obvious benefits of evidence-based programs or practices, which is why this federal expectation was introduced, is evidence-based programs, by definition, they have shorter lengths of service. When we're doing something called services as usual, SAUs, those services tend to get kind of very nebulous. The goals are a little murky. Sometimes DHS gets involved with families and we can't figure out how to ever close a case. These evidence-based programs have a much more rigidly defined treatment goals, expectations. There's fidelity to various curriculums. And so that helps drive families to getting the appropriate level of support, but also helps them kind of move through services and get the treatment they need. All of the evidence-based programs that are being approved in the Federal Clearinghouse, because they are child welfare specific, they are known to reduce repeat maltreatment. The two models of practice that we have selected to implement in Iowa, both of those models, that's definitely a highlight of the benefit of these particular interventions. Both have substantially reduced repeat maltreatment with family units, so I'll go over that a little bit. And lastly, not only are the caregivers who receive these interventions, evidence-based programs, much more satisfied with those interventions, the workforce is actually much, much happier when they are doing interventions that they know work. So that was kind of a latent or an unexpected benefit as some of these evidence-based programs were evaluated. The number one reason why people leave child welfare is they don't believe they're efficacious. They feel like they're working really hard for families and they're not making things any better. The second reason why people leave child welfare is they don't feel supported by their supervisor. And the third most common reason cited by people who leave is wages. So in those three orders, we start to address the issue of being efficacious when you implement those evidence-based programs. So. Okay, so let me, within the Family First Act, there's kind of like a frontier of opportunity. So states could make lots of different decisions that within the scope of the Family First Act. In Iowa, we made two decisions regarding evidence-based practices. The first is we decided to statewide implement a program called Safe Care. Safe Care is a model that is specific for parents with children under the age of 6 years old. So it is for what we call our little ones. Our little ones are the ones who mostly make up our foster care population. That makes sense. Our kids under the age of 6 are the least able to be self-protective. They are most vulnerable when situations of abuse and neglect arise. And we frequently, families come to the attention of DHS frequently when babies are born. So, you know, it is not uncommon for DHS to get calls of what we call PIDs, which is basically the presence of illegal drugs in the system of an infant, and some of that drug testing that maybe takes place when babies are born. So we know from the research, and Safe Care was extensively evaluated in Oklahoma. They completed a 5-year longitudinal study with a very large pool of families. And then they did a control group, and then they did a group that got Safe Care as their intervention. Those families who received Safe Care and graduated saw a 75% reduction in repeat child maltreatment. Safe Care is a model that can be completed in 6 months. It is a once a week, very kind of rigorous, time-sensitive model. So you cannot miss more than 2 weeks of meeting with the family without some of the skill that you're teaching eroding. So you kind of then have to restart those sessions you're working on. And Safe Care targets 3 major risk factors for abuse and neglect. And those are the parent-child or parent-infant interactions. So another way of describing that is attachment and bonding. The second is systematic health decision-making, or what I also call making appropriate medical decisions for your kids. And then appropriate supervision, which is also about making the home environment as safe as possible for a child. So I'm a parent. If you were like me, you kept a lot of chemicals under your kitchen sink, chemicals that would be very, very bad for kids to get into. And if you don't move those chemicals to be out of arm's reach of a child, or if you don't put locks on things like cabinets, we know that it's very easy to have a hazard in a home that quickly can turn into a dangerous situation. So Safe Care for 6 weeks goes over home safety, making sure that windows that are a certain height either have bars or there's ways to keep kids out of those, away from windows that could be hazardous for falls, things like that. And you can also see that this model, as it was done in Oklahoma, there was also a big enough subset of Native American parents who were enrolled in this study, and they were able to demonstrate equal effectiveness with Native American parents as well. So there's some cultural responsiveness that's kind of baked into Safe Care that we really like. We have a lot of tribal representation in the state of Iowa, and we always want to be sure that our evidence-based programs or the services we provide are equally efficacious for all the families that we come into contact with. The other evidence-informed model that we implemented is called solution-based casework. All families, so this is not limited to families with a child under the age of 6, all families get solution-based casework if they have a DHS social worker. So this is a framework that helps families establish goals around particular family problems, such as mental health or work-related issues. It could be about anger management, domestic violence. There are a number of situations that DHS becomes involved in. Solution-based casework is a really nice framework to bring the family together and try and problem solve and strategize to a successful conclusion. Both of these models, to the previous question, even if a child is placed in foster care, families are eligible both for Safe Care and solution-based casework both. So let's say I have a child who's 3, they're placed into foster care, but I'm doing regular visits with my kid. A practitioner trained in Safe Care can be coming to my home to work with me separately through some of the curriculum. But when we got to the module around attachment and bonding, they would be doing those Safe Care sessions when I am visiting my child, because a lot of that is skill building while I'm actually interacting with my child. It's about creating a situation around positive decision making, so giving kids limited choices, rewarding good decisions, things like that. Family preservation is an intensive in-the-home crisis-oriented service. So this is a service that is purchased in 10-day packages. Of those 10 days, the family would have a family preservation specialist meeting with them for at least 8 of those 10 days. The goal of that service is to help stabilize that family temporarily while we get some kind of longer-term services in place. We are also able to use family preservation if a child is placed in foster care, but they're placed with a relative or fictive kin. So let's say a child is placed with aunt, and aunt immediately is experiencing a crisis with the child. We can put family preservation in those situations as well, because we're trying to stabilize those natural supports. Okay, any questions about the key decisions that we've made for programming in Iowa? Okay, I'm going to touch on this part just a little bit, but this is an area that I already talked about a little bit, that we are limited in our federal financial participation if we are placing kids in group care or congregate care settings. One of the requirements under the Family First Act is that all group care providers meet the definition of a qualified residential treatment program. And I will talk a little bit more about that on the next slide. So instead of having group care, we now have QRTPs in Iowa, because that's the first criteria for continuing that federal financial support. The second is, in addition to it being a QRTP, that youth or child must be clinically assessed and it be demonstrated that they have short-term and or long-term mental or behavioral health goals that cannot be met in a community. So they cannot be met in a family or family-like setting. So those two criteria must be in place in order to continue to receive federal financial support for those placements. A QRTP basically means that they have the staff available to meet the treatment needs of those youth. They also must have access to nursing staff 24 hours a day, 7 days a week. They must work with the family. So the idea that you can just provide treatment to an individual child that helps then prepare them for reunifying with their family or moving into a community, it is wrong. You do not treat people in isolation. You treat people in the context of relationships. And so one of the federal requirements is that the QRTPs facilitate outreach to family members, siblings, all the people listed in the fourth bullet point in front of you. And they need to provide aftercare support for 6 months after they have left the facility. Okay, I'm going to skip that slide. Okay. Any questions about efforts to reduce our reliance on residential-based services in Iowa? Okay. So I'm going to make a slight pivot and move away from the technical aspects of the Family First Act and talk to you more about Family First as a philosophy. So Family First being more of a cultural shift around how we do practice at DHS. It's a shift in our contractual expectations with our providers who we contract with them for many of our core services in the state of Iowa. And we have other key partners around how these decisions are made, and that includes our judicial partners. So let me talk with you a little bit about a pilot program that we did at the end of 2019. And I think this pilot, it was more of a kind of a DIY hack, and it produced really impressive results. So I want to share that with you. This pilot emerged out of some conversations I was having with a couple of judges who were really trying to live that family first philosophy. And for those of you who don't know, every child placed in foster care had a judge that signed off on that request to place them into foster care. DHS doesn't just place kids into foster care. There's judicial oversight because it's a legal decision to place a kid in foster care. So I was having a roundtable discussion with some judges, and what they said is, you know, I would love to be able to say no when DHS or county attorneys ask me to remove a child, but I don't really know how to say no. I'm not the one who was in the home. I don't know how those parents were presenting. I don't want to second guess the people who are making this ask of me because I'm just not in the best position to do that. But it was kind of interesting, the flip of that, if you were to speak to some DHS workers, they would say that a lot of families kind of live in that gray space. Like maybe the kid will be fine. We're not really sure. But you know what? Best just to ask a judge because it's not really up to our authority anyway. So we might as well ask. And the judge is thinking, well, if you didn't need to do this, you wouldn't ask. So I'm approving it. So in talking it through with the judges, we helped identify 4 questions that if a judge could ask anytime they were asked to sign off on a removal, maybe we could have a different conversation. And so the 4 questions that are up on the screen in front of you, we put these on little cards and we laminated these cards, and 7 judges that represented regions throughout the state. So we had total state representation. They decided to, for 4 months, ask these questions every time they were asked to do a removal. And you can read those questions yourself. And the data was incredibly impressive. So the data is up on the screen in front of you. What you can see is from August to November, when they were not doing the pilot, these judges approved 99 requests for removal. 42 of those kids went to relative, 9 with fictive kin, 34 went with licensed foster parents, and 13 went to shelter. Over between December and March 2020, they did the same pilot. I mean, they did this, they kept track of all the requests that came to them, but they did those 4 questions. What they saw is over that period of time, they received 83 requests, so not that dissimilar from the 99 they'd approved. Of those 83, they approved 44 requests for removal. 24 were placed with relatives. 5 were placed with fictive kin, and 15 were placed with licensed foster parents, and none went to shelter. So you can see for that pilot period, we saw a 56% reduction in approved removals, a 15% increase in the rate of placement with relatives and fictive kin, and none of the kids went into a residential setting. So this was a very kind of seismic and very valuable shift with a very low level of effort from the judges who were involved. Okay, questions or comments about this pilot? Okay, another family first philosophical shift that we have made in the state. You may recall I talked a little bit about that family preservation unit, which is that crisis-oriented service that goes into the home almost daily. What we have done is rolled out something called child safety conferences. So any family who gets that family preservation service is also then being pulled into a child safety conference. And at that child safety conference, it includes DHS leadership, the contractor who's working with the family, and the parents. And what we tell them is our goal is to strengthen and preserve the family connections. And we need to do this while also keeping the child or children safe. So what we want to do is do creative planning or kind of outside of the box thinking to figure out what would it take to keep this child in the home. And if we are unable to plan in a way that keeps the child in the home, what would it take to keep the child placed with kinship or fictive kinship care? So in doing these child safety conferences, we did them in the 10 counties along the eastern border, mostly with Illinois. We held over a little over a year. There were 123 child safety conferences involving 222 kids. It would be important for me to explain to you that a child safety conference is actually not a one-time activity. It's what I call a two-step. We actually have 2 conferences that happen within 10 days of each other. So we have an initial conference, and then we have a follow-up conference. You can see after that initial conference, we were able to keep 137 kids still with their parents, 60 with their relatives, and 17 with fictive kin. So if you kind of quickly add up that data, you can see that around 95%, actually greater than 95% of all of the kids, we were able to keep them either with their parent or in their natural support network. And the data was very similar for those same families. 10 days later, we came back together to say, how'd that plan work? And again, you can see this time there were 138 kids with their parents, 56 with relative, and 17 with fictive kin. So still hovering right around 95% or greater success, just by early and often getting the right people involved in kind of that emergency planning to say, what would it take to keep the child safe, but also strengthen and preserve this family? And we're getting some really different outcomes based on this approach to doing the work. Okay, any questions about child safety conferences? Okay, this next policy shift and resource shift I'm going to talk to you about will be starting in July, and this is a really big shift. Usually when I'm doing presentations on Family First, I ask people in the audience, if you have children that are not your own, but that you love and care about. And usually I see a lot of hands go up. And then I ask them if those kids that they just thought about, if they were to get a phone call tomorrow that said, this kid is going into foster care, would you take them into your home? The majority of people keep their hand raised. They say, yeah, I wouldn't want them sent to somebody they don't know. Of course, I would open up my home. Then when I ask how many of those people are licensed foster parents, most put their hand down. In Iowa, even though we have the opportunity to place kids in those unlicensed settings, so most of you would be unlicensed unless you happen to be a licensed foster parent. I would be an unlicensed placement. Although it's great we can place kids in those unlicensed settings, we cannot pay for the cost of care for those kids. We are limited right now to provide stipends or payments to licensed foster parents. So licensed foster parents get approximately $20 to $25 a day. They get about $650 a month, where our unlicensed caregivers get nothing. And we know that kids are not free, right? So sometimes we see economics being the barrier for a child being placed in a home, and definitely keeping siblings together. That's an inherent obstacle if we do not provide financial support. So starting in July, for the first time, we are rolling out a plan that allows us to give a $300 stipend per child that is placed in an unlicensed home. That payment will be in place for up to 6 months while we work with that unlicensed caregiver to go through the licensing process, because then the payment goes up to, as I said, approximately $650 a month. So this shift, as I mentioned, it's a big deal for us, that just in two short weeks, we will finally have an ability to push out payment to our unlicensed caregivers. So this is a level of detail you probably don't need. Okay. Are there any questions about the kinship caregiver stipend that we're rolling out? Okay, so this is an example of one of those hyperlinks that work. Let me escape out of this. And I want to show you what's on our website. It's called our Family First Dashboard. So as I mentioned, we just went live in October 2020, but we have been working at our Family First philosophy intently for the past 3 years. And I think that some of our data really tells the story and shows how effectively we've been working at this. Okay, so as you would expect, a state that is doing a good job with their Family First implementation would start to see their rate of foster care placement go down. So I told you when I first came to this state in 2015, Iowa was at a significantly higher rate than the national average. Let me show you what's been going on for the past 2 years though. So in Iowa, we're broken out into service areas. You can see we have Cedar Rapids service area, Des Moines service area, Eastern, Northern, and Western. Western historically has had the highest rate of removal of any service area in the state. And that is true on this dashboard. You can see they're way up here at 7.7. If we still had our data up from the quarter before this, you would have seen that Western was over 8 kids per 1,000 for that particular quarter. But the good news is, look at what's going on in the Western. If you pay attention to that purple line from quarter 4 all the way up to the most recent quarter, all you see is a downward slope. So at that quarter being at 7.7, if I zoom along that line, you can see that Western has reduced their rate of removal down to 4.4 kids per 1,000. So they've almost reduced it in half in 2 years, which is incredible. It's really remarkable. But if you just kind of look at visually all of these lines, they're all basically going down. Eastern, where I talked specifically, we were piloting those child safety conferences. You can see them way down here. So this is back when they're doing those child safety conferences. They're way below the other service areas in terms of kids that they were placing into foster care. They were down at 4.3 kids per thousand, going down to 3.6. So they're kind of, they're down to 3.4 now. So again, below 4 kids per thousand. I told you at least in 2015, the national average was around 6 kids per thousand. So you can see all of our service areas are in a gradual but kind of methodical downward shift towards using foster care as their intervention. So let me show you one more data tile, because as you can imagine, our rate of placement into our residential services, that should also be going down, right? Based on what I explained to you today. Hold on, I got to get my years right really quickly. So let me limit the data to the most recent quarter. And I will show you when kids are in foster care, where are they in Iowa? That'll be easy. Okay, I'm having a little lag. 1 second. Okay. It's being a little slow. On Q3. There we go. Okay. All right, so I think the most important part of this dashboard is this donut that's up at the top. So this donut represents all the kids in foster care for the last quarter in Iowa. So if you were to add up each of these numbers, you should probably see, let's see how many kids are in foster care. That would tell you what the total number of kids in foster care is. So you can see that down here actually. So the total number of cases for the state, 5,623. DHS combines our data with JCS, so kids who are placed into foster care because of what we described delinquent behavior, they show up in our foster care population. So a little over 9% of all kids in foster care are there due to delinquent behavior. 90% are there because of a child welfare related issue. On this donut, you can see of all the kids in foster care, over 2,200 are living with relative or fictive kin. So basically 40% of all the kids in foster care are living with people who they knew and who cared about them before going into placement. 820 kids are on what we call trial home visit. So they're actually living with their parent. The judge overseeing the case has said, I want this to be considered a trial. I want to see how this goes. It's kind of like probationary parenting. So those kids are technically in foster care, but they are living with their parent. So if you add up these two percentages, you can see 40% and basically 15%. Over 55% of all kids in foster care in Iowa are living with someone in their natural support network. This little purple piece of the donut, this is our QRTP, so what was previously called group care. We have 355 kids statewide living in group care. 144 of those are DHS, while 211 are JCS. And you can kind of see the other levels of care. So foster parents, about 24%, 25%. And these kids, 343, are in a home that is presumed to be an adoptive home. So they are also living with what will become legally their parents, is the plan. So also living very much with people who are considered family or family-like. So, okay. So with 4 minutes to spare, what questions or comments or anything?
Any final comments for Janee?
What role do you see employment playing for the, the mothers or fathers of these, they're going through difficult times? Talk a little bit about how to help them move forward.
So I see workforce intersecting with this family first strategy in two key ways. The first is I would be remiss to acknowledge that a stable workforce, particularly with our private contractors, is essential to providing a high quality service. So anybody who knows something about evidence-based programs knows there's extensive training involved. There's a real skill involved in delivering those evidence-based programs. If we do not have a stable workforce here in Iowa, people who really have a passion for child welfare and who are cut out to do that work, what we see is a very high level of turnover. And there have been a number of studies that show the more workers that a family has, it is highly correlated with very bad outcomes for that family. So kids with a lot of workers ends up in foster care much longer, reunification rates go down. So I always say we are very much just being aspirational around high quality services if we can't even figure out how to stabilize our workforce. Part of that is tied to having fair and competitive wages. So we're doing some stuff with some of our core service contracts in order to try and shore up some of that payment. But some of it also has to do with capping their responsibilities. If in some of these jobs, you're expected to work 60 hours a week, every week, you burn out. Like, we're getting in our own way in terms of what we're really trying to develop in the state, which is people who really have a passion for this work, want to work with families, and are committed to doing the hard work. But we need to create the conditions under which they feel supported. So that's the first. The second is the parents who are the recipient of the services. We also know that there is a positive correlation between people who work and people's mental health and well-being. So having, it's like relationships and work are the key defining characteristics of what is kind of a productive life, right? So if you have valuable relationships that you care about and you are involved in work, those are highly correlated with positive things that we want the families that we serve. So.
See, Teresa also asked in the chat, what about kids who age out of foster care? Are transition team meetings still happening?
Yeah, so we have dedicated transitional planning specialists around the state who work specifically with those youth. Once they've reached, I believe, 17 and a half, they get a dedicated TPS worker, that transitional specialist, to work with them. And we have something in Iowa pretty unique that most states don't have. And what that is something called our aftercare program. That is a competitively procured program that provides intensive case management for those youth who age out of foster care, and they are eligible for a monthly stipend, those young adults, to help them cover costs. I believe that monthly stipend is around $600. They do need to be meeting with their intensive case manager. They need to be doing things kind of around work and school and things like that. And then they receive that stipend based on doing some of those independent living activities.
So I know we don't have much time left, but so we're the service provider for the WIOA youth program, which is yeah. So I was wondering, like, what's the best way to get connected with the aftercare so we can assist some of these youth in maybe additional training and job placement and things like that?
Yep, I know just the people to connect you to. I'm putting my email address in the chat. Any of you can use it and reach out to me. But Teresa, I know exactly who you need to meet with, and I'll get those connections made immediately.
Perfect.
Yeah.
Excellent.
Okay, well, all of you know now how to reach me. So if you think of something later and want to send me a note, I am very responsive to my emails. So I would love to hear from you.
Well, we very much appreciate you being here, Janee. And yeah, if you haven't copied her email out of the chat, please do so. And all of these resources that you've provided will be on our website by tomorrow. So if you missed anything, want to go back, please go ahead and check it out.
Great. Thank you for the invitation. Be well.
Thanks. Bye.
Thanks.